palpate trapezius, right? So you guys know that. For supraspinatus, I'm actually gonna come in front of her because I'm gonna support her arm in scaption. So in the plane that we know biases supraspinatus, right? Remember from our manual muscle tests? Instead of straight abduction, if we put into scaption, that usually biases supraspinatus. So you're gonna find the spine of the scapula, and then you're going to go slightly superior to that. And typically you're going to use deep palpation and try to palpate transversely to that muscle belly. And again, it's deep to the trap. So for some people, they might have a lot of tissue bulk or in the trapezius that makes it hard to get deep enough to get to supraspinatus. But you can palpate, again, in that supraspinous fossa above the spine of the scap to feel if there's any tenderness, hypertonicity. Is it tender, painful at all? Just a little tender, okay. And does it radiate at all? Okay, good. So here's supraspinatus muscle belly. Now, if we wanted to palpate the tendon, what we need to do is place her arm behind her back. Good. Now we find the acromion. So you can follow the spine of the scapula to the acromion. And did that tickle me? That was weird. Okay. And then you're going to essentially drop straight off on the anterior aspect of the humerus, and you're gonna run your fingers, and maybe I'll have you, can you turn around? So that the camera can see it. So the tendon will essentially, in this position, the tendon should attach onto that greater tubercle in this direction. So when we palpate it, we wanna palpate in a medial lateral direction. And there should be like a very, very small ropey tendon that you feel in that region, okay? And this is really common to be inflamed or irritated on individuals who have rotator cuff pathology, and it can be treated with using cross-friction massage. And so to do cross-friction massage, first of all, do you have tenderness?
A little bit.
A little bit, okay. So you would assess your baseline pain level, 0 to 10, so what would you rate it?
5.
Okay, so 5. I'm gonna take my index finger, I'm gonna reinforce it with the middle finger, and I'm going to apply frictions along that tendon. So I'm just showing you guys this just because it's just a little bit more seamless to kind of teach you the soft tissue mobilization technique now that we're palpating it. You would do this for up to 2 minutes, 2 to 3 minutes, depending. And you'd be asking and assessing the patient about midway through, is it getting any better, worse, or the same?
A little bit better.
Okay, so you're looking for it to get better. And do you guys remember what the mechanism behind cross-friction massage, like why does this work? What does this do?
Fibroblasts.
Yeah, fibroblast recruitment, yep. So it's thought to increase fibroblast recruitment, which then helps lay down collagen, and it's also increased blood flow as well. Okay, so that's cross-friction massage to the supraspinatus. And what's your pain level now? 0 to 10?
3.
A 3, okay, we started at a 5. So ideally, we'd get it to go down by half. So I'd probably do this a little bit longer for her. Okay, but that is our supraspinatus tendon palpation and cross-friction massage application. Okay, so you can relax that. Any questions on that? Okay, and then